Hi, I'm Dr. Margo Weishar at Springhouse Dermatology, and I want to welcome you all to our virtual skin rejuvenation event featuring our new UltraClear laser. So I'm very excited to introduce UltraClear to my practice. As many of you know, I've been doing laser resurfacing for many years, but UltraClear has brought to the field some new features that are really unique and really advanced. Number one, we can do a very light resurfacing, which we call 3D Miracle, on anybody's skin to refresh their skin and bring back a glow. And that is a very low downtime procedure, a very quick procedure. It can also be done on necks and hands and other parts of the body. And it's also very safe for all skin types, which means we can treat patients with any color skin. Going onward, we have the UltraClear version of the treatment, which is a deeper treatment for deeper lines and wrinkles, some acne scarring, and all the way on up to something really unique to this device called laser coring. Laser coring is a method that we can actually cause a lot of skin tightening and really reverse a lot of changes like scarring and deeper lines and wrinkles. UltraClear differs from our current lasers in that we can do treatments either with no numbing at all, like the 3D Miracle, or even when we're doing our more intense treatments, we can use just topical numbing creams. So it doesn't involve any injections, and patients are very comfortable during the treatment. In addition, we have the ability to treat patients of any skin color safely. So this allows us to treat even acne scarring or deeper lines and wrinkles in darker skin types, which we have not been able to do before. For patients with sun damage, meaning pigmentation, a lot of brown spots, breakdown in collagen, thinning of the skin, UltraClear is a perfect treatment because we can treat all of those things with one treatment. In addition, patients who have scarring, either from surgical scars, acne scars, even old scars, we can improve with UltraClear. Lastly, patients who have a lot of loose skin, especially on the lower face, around the mouth, and in the neck, we can use our laser coring function to help tighten up that skin and make real and significant improvements without surgery. So candidates for UltraClear really run the whole spectrum because UltraClear runs the whole spectrum. For 3D Miracle, which is the lightest version, really anybody can do this. I think it's ideal for the younger patient who is just starting to see some degree of breakdown of their collagen, some fine lines and wrinkles, and maybe some early sun damage. Perfect treatment. Once you have achieved your goals, even in patients who have more issues, this is a great way to maintain your skin as well. So for somebody who is older and has been through some procedures and just wants to keep that improvement going, 3D Miracle is a wonderful treatment. For the more advanced treatments with UltraClear, they can really take care of so many different problems all at once. They can improve pore size, they can improve sun damage, meaning lines, wrinkles, pigmentation, brown spots. They can improve old acne scars, and they can help tighten up the skin. Although patients will be fully healed after 1 week, the results keep on accumulating for up to 6 months. So I tell patients there's 2 types of healing. One is the surface healing, which really happens quickly, and that will allow you to get back to using various products and makeup and so forth. And then there's what's going on deeper under the surface, and which is collagen renewal and bringing new collagen into your skin. And that process, once started, will continue for up to 6 months. So the downtime will really depend on what level of treatment you're getting. For 3D Miracle candidates, that means a day or two of looking a little red and a little bit puffy, with about up to a week of feeling a little grittiness on the skin, but basically returning to social activities after about 48 hours. For the more advanced treatments, UltraClear and laser coring, that is a week of non-social downtime. In other words, you're in your house for a week while you're healing. So you're not going to feel uncomfortable. You can do things. You can work from home with your camera off if you prefer, but you're not going to be ready to resume social activities for up to a week. We usually see patients back at the end of that week in order to clear them to resume social activities. Hi everyone, so we're here with our lovely patient Carol, who just went through the UltraClear experience this last week. So this is her 1 week follow-up. And so we're just gonna find out what that was like. So Carol, tell me, were you prepared for what you experienced?
Well, when I first looked in the mirror the first day, I was like, oh my gosh.
Yes.
And then I realized it was everything you told me it would be. Bright red,
yeah.
Like I'd been way too long at the beach.
Yeah.
And a little burny.
Yeah. And how was it feeling like when you got home? Like, were you uncomfortable or what did you do?
Uncomfortable is too strong a word. I mean,
okay.
It was definitely like if I moved my mouth too much, it burned a little.
Got it.
Definitely not to touch. Like I couldn't touch it. But see, so I got home about 1. And by 3:30, I think I even texted you, by 3:30, the burning had stopped.
So it goes away fairly quickly.
Yeah, it really did. To touch it, it would still be tender. But just sitting normally, it didn't burn anymore.
And when did you feel it was starting to like recover, turn around a bit?
I felt certainly more comfortable by that evening. But sleeping was difficult.
Yes.
You had given us a little disposable thing for the pillowcase, which is great because the balm was...
It's very greasy and everything.
Just a little bit, not a lot.
Well, thank you for sharing your experience with others. We know that people who are contemplating going through something like this, it's often really great to hear from somebody who's experienced it on themselves. So this is just the start of her journey. I mean, it's the end of that period of time where the intense healing is happening. But of course, over the next 6 months, we're going to be following Carol's progress, and we're going to be seeing the results of what the UltraClear does, and the laser coring, which she had, will continue to improve for up to 6 months. So thank you so much.
Oh, my pleasure. Thank you.
Hi, everyone. Thank you so much for joining us tonight. We really appreciate it. So Dr. Weishar and I are just going to go through some of your questions. I see a lot still popping up in the box, so please feel free to keep putting them in there. Let's get started with some of these questions because we have a bunch to go through. So Dr. Weishar, let's start out with how many sessions are generally recommended for ideal results?
So first off, thank you all for being here, and thank you for staying, and thank you for throwing so many questions in our Q&A, and I'm definitely going to try and get to as many as I possibly can. So how many treatments? And that really differs based on which version of this treatment we're talking about. So with the 3D Miracle, which is the lightest version, as McKenna alluded to, we recommend that we do a series of 3 treatments. What we're trying to do here is build your collagen, turn on the cells that produce collagen. And if I could just diverge for a moment, as we age, there is a collagen loss in our skin. And as our skin loses collagen, things like lines and wrinkles start to appear. So one of the things that the 3D Miracle does is it's turning on that regenerative capacity of the skin to build back your collagen. So what we do in the beginning is we start out with a series of 3 of these, and then this is a great treatment, a wonderful treatment that you can put into your plan to maintain your skin over the many years. So this is the kind of thing you can go back to a couple of times a year just to refresh your skin, keep that collagen forming, keep that process being turned on. So that's one aspect of this laser. On the other side of things, on the more advanced treatment with the UltraClear and with the laser coring, those are bigger treatments. They're more intense treatments. They're meant to be a one-time treatment. And in case it wasn't totally clear from the presentation, you are healed. The surface of your skin is healed in a week. That's where we want you to take that week off from anything, social activity. But there is healing going on under the surface of your skin for up to 6 months. So that laser is helping your skin to remodel and create new collagen. So at the end of that 6 months period is when we really evaluate where we got to with that treatment. And, you know, in many cases, it's going to get us all the way there. In some cases, it might be that we want to go back and do a little bit more. So that is really meant to be one big, more comprehensive one-time treatment.
Great, thank you. And I think that you can kind of tie into this next question, which is how do you time this with things like Botox fillers when you're creating your treatment plan?
So the 3D Miracle, which is the lighter version, can be done at the same time as Botox and filler. They will not interfere or interact with one another. With the UltraClear, because there's a lot more tissue swelling, I would definitely recommend separating those treatments into 2 different times. Either we do the injectables a week or 2 before, or maybe a week or 2 after you're healed, but not at the very same time.
Perfect. And does this treatment work on light colored scars?
So one of the most exciting things that we can do with this laser is improve scars. And this includes even old scars, so surgical scars, traumatic scars, scars that are raised, scars that are even depressed, meaning sunken in. We can help rejuvenate and regenerate collagen and normalize tissue around scars. Now, that being said, it's never going to be perfect, but we can even improve very old scars. And then on the other side of that, we also use this. This is going to be the premier treatment for acne scarring. One of the aspects of this laser that, again, we didn't have time in the video to go through, is it's what's called a cold laser. So what that means is that the energy of this laser is so specific for what we're treating that it doesn't generate any heat around the area that's being lasered. So what does that mean for you? What it means is I can perform a much more intense treatment with this laser, and you'll still have very quick healing and very quick rebound. So it's really phenomenal, the amount of different options that it gives me and the amount of different things that we can treat.
Of that same tune then, can this help with under eye, fine lines, and wrinkles?
So the answer is absolutely yes. One of the doctors who worked on this laser and when it first came out is actually an oculoplastic surgeon. And I've worked with him directly. And he uses this laser all the time now, almost instead of blepharoplasty. So in a patient with more crepey under eye skin, fine lines and wrinkles, this may be the ideal thing and not surgery.
Okay. In the video, what was the tube that was in the mouth of the patient?
So the pink tube is a nitrous oxide blend. So if you've ever had nitrous at the dentist's office, you'll know that that puts you in kind of a very relaxed and happy place. I call it on the beach with a margarita in your hand. So you're not knocked out, you're awake, but you're very, very relaxed. And this is how we This is the treatment that we use for our more intense version. It is not necessary with the 3D Miracle at all, but for patients who are undergoing the UltraClear or laser coring, we do use it. The beauty of the nitrous oxide mix is that you inhale it, you breathe it in as much as you need, and when you're done with your treatment, about 10 minutes on room air and you feel totally back to normal again. So it washes out very quickly and it's very safe.
Okay. How does UltraClear or 3D Miracle differ from Clear and Brilliant?
That's a really great question. And I'm sorry if I'm going to get a little technical for you guys who didn't like physics in high school, but both of these lasers are considered to be fractionated lasers, which means that they take the laser beam and they break it down into tiny little microbeams. So that's a similarity. The difference is that in the Clear and Brilliant, the microbeams of tissue are being heated by the laser, whereas in the Clear and Brilliant, I'm sorry, in the UltraClear, now I'm confusing everybody. In the UltraClear, these microbeams of tissue are being vaporized. So it's actually a more aggressive treatment, but because it's a cold laser, we can do this treatment with no numbing. So those of you who have had Clear and Brilliant know that we always numb. That is not necessary for the 3D Miracle. We use cold air during the treatment, and that's all that patients need. And you're actually getting a more advanced treatment, and you're getting it more quickly without the necessity for any kind of anesthesia. It can also be done on necks, on chests, on hands. So because the procedure is very, very efficient, we can do all of that in maybe a 30-minute treatment.
And you keep mentioning that this is a cold laser. So does that mean that it feels cold?
Oh, that's a really good question. No, not at all. It doesn't feel cold. It feels a little prickly. And I would say, I don't know that you feel heat from the laser, but after the laser treatment is done, you will feel hot like a sunburn.
Okay, perfect. And let's see. Which do you recommend for sun damage and age spots on the hands? So if someone's primarily got sun damage, would you recommend doing the 3D Miracle or the UltraClear?
If you're really just treating spots on the hands, it might not even be the UltraClear laser. It really would depend on the patient. If it's kind of generalized pigmentation, I would say most likely the 3D Miracle. But if you have actual spots, we might use one of our other lasers that are more geared toward pigmented areas.
Okay, and let's see. How soon after the first week can you return to activities, swimming, golf?
So I'm assuming
exercise?
You mean after the more intense treatment.
Yeah.
So I stay in contact with my patients every day. I make sure that you send me pictures on our HIPAA compliant Spruce app. So we communicate daily while you're healing. So I see you and can answer any questions that you have. And then we follow that up with a face-to-face appointment at 1 week, at which time I, hopefully will clear you to return to all your social activities. Usually I can get a good sense of how you're healing by the communication that we have over the week. So I kind of know that you're going to be ready. And when you come in, I will check your skin face to face. And if everything's good to go, then you'll be able to wear sunscreen and makeup and resume activities after that.
So if you've never had any facial treatments or anything done before, do you think UltraClear is an okay place to start?
Absolutely. I mean, I think 3D Miracle specifically is an ideal treatment for the younger patient who is just starting to notice some sun damage, some loss of collagen, some fine lines, maybe some pigmentation. I think it's a perfect kind of initial treatment for that. I also think it has a role, though, for patients who, like myself, have gone through other treatments and just want to maintain my skin. So, it can be done in patients who have already mature skin, but have basically already done what they need to do to clarify their skin and now just want to continue the glow and continue building collagen.
What is the longest initial recovery time that you've seen with UltraClear? Have you had any negative reactions? And what can you do to speed up the healing time?
Okay, all good questions. So really, it is very consistent around 7-8 days, not much longer than that. And that is even with the most advanced treatment that I have done. We have been doing skin resurfacing for decades in my practice. We were doing it with a laser called the CO2 laser, which is actually even a more difficult laser to work with than the UltraClear. So I am very well versed in any type of complications that can occur from laser resurfacing. And because of that, we have everybody on a very strict protocol. So for the patients who are having the more intense treatments, we do a pre-op visit with you, at which time we give you prescriptions for antibiotics, antivirals, anti-inflammatories, and we also will hand you at your visit exactly what we want you to use during the week that you're healing. And I am very strict about that because having tried many, many different products over the years, I have refined it to the ones that I know work really, really well. So part of our discussion is that we're not going to deviate from the plan because that plan is made to shorten your recovery and to keep you safe and to keep you out of trouble. But McKenna mentioned two things that I wanted to talk about that are additions that we can use with our treatments. So a lot of you are probably familiar with exosomes. They've been in the news a lot, and these are cell signals that have been able to be purified, and we can use exosomes, and especially this particular product, Plated, we use with our 3D Miracle. Because there are now channels that we have created into the skin, we can allow these exosomes to really sink into the skin. And what this does, it's just boosts the result. So this is boosting the collagen renewal, boosting the cell turnover, sort of supercharging your results, if you will. And then the other treatment that we do for the patients who are undergoing the larger and more advanced treatments is called Ariescence. This is platelet-derived growth factor. So this is something that we also put on the skin immediately after the treatment. Sometimes we have a little left and we'll give you a little bit to use at home as well. And this also speeds healing and supercharges the treatment.
Okay. What are the potential side effects? Are there risks of scarring or like pigmentation after treatment?
So with the UltraClear, I will say first off, pigmentation is much less of a concern. Loss of pigmentation was much more of a concern with the CO2 laser. But with any laser, and especially a laser that's potentially as powerful as the UltraClear, you want to be in the hands of somebody who has done many of these treatments, because any of these are tools that can be misused. And if the settings are wrong or they're wrong for your skin, scarring can always be a possibility. One of the biggest concerns that I always express to patients is after you're treated and your skin's a little pink, you must protect it from the sun, because there's something called post-inflammatory pigmentation, and that can occur about a month after the laser treatment is done. If you do go out in the sun or you don't protect your skin from the sun, you can start to get some buildup of pigment. Now, that is something that I know how to remove, but we always try to avoid it happening and not worry about having to remove it after the fact.
Okay. Never mind, we already answered that one. So the patients whose photos were displayed during the treatment, which version of the treatment did they have? So I guess that would be the ones that we
I think
at the end there.
Yeah, I think that everybody that was on that was a version of the UltraClear, the more advanced treatment. For those of you who want to see some befores and afters of 3D Miracle, I don't think they were included in this, but if you text us that, we're happy to send you some of our photos and some of the other photos that we can share.
Would you say that this treatment can be an alternative to injectables?
So I love this question, and I love this question because I think it kind of speaks to the whole approach to maintaining your appearance, right? So we know that external factors like sun damage and environmental damage, they help break down your collagen and elastin. So does just time. Over time, our collagen peaks at 25, and every year after that, we lose 1%. So if you're 45, you've lost about 20% of your collagen. What does that mean? The collagen is the thing that gives your skin its support, and the elastin is the thing that gives your skin its flexibility. So if you lose support and you lose flexibility, what happens is your skin cannot resist the motions that you normally do, your smile, your frown. So you start to see lines start to appear in those areas. So I think a well thought out approach to maintaining your skin over time and minimizing the use of neuromodulator and potentially filler involves using something like UltraClear or 3D Miracle to maintain this collagen that you have and rebuild any collagen that you've lost. So I think all of these things can work together, and the more that you maintain your collagen, the less reliance on those other things you're going to need.
So we've talked quite a bit about 3D Miracle and UltraClear you've mentioned, but can you go into more detail about what the laser coring is used for?
Yeah, so laser coring is probably one of the most exciting things about this treatment. So many of you have probably, if you follow the world of rejuvenation, heard of a device called EllaCore that came on the market a couple of years ago. And without being too gross, EllaCore basically takes cores of tissue out of your skin mechanically. So it's like taking tiny little cores of tissue. And so this device, which came out of Harvard, so a lot of smart people worked on it, got a lot of buzz because when your skin healed from this EllaCore treatment, because you're now taking out tiny little bits of tissue, it's tightening up your skin. It was not a treatment that excited me. However, I thought it was rather crude in the methodology, but UltraClear came along and they now have the ability to use a laser to do a very similar type of treatment. However, with the laser, we have infinite control over how deep we go, how large the cores are. And so what we're doing now is we're actually using the laser to take these cores of tissue out and causing significant tightening around the eyes, around the mouth, lower jaw, necks. So laser coring is, I think, just at its beginning, at its infancy of different applications. Maybe someday we'll be using it on arms and other places, but right now we're getting some pretty terrific results. I think there was a picture that went by very quickly about one of my patients, and you could see her jawline was already tightened up, and this was only about 2 weeks after her treatment. It was pretty miraculous. So it is definitely something I'm very, very excited about.
Okay. Good for melasma patients?
So great question. I think it might be the best thing for melasma patients, because melasma, oftentimes there is a vascular component, and the 3D Miracle can both improve the vascular component and the pigmentation. So it is definitely an area that I'm really excited. There's not a lot that we can offer that's safe for melasma patients, but this is definitely going to be one of those things that we're going to be using more and more.
And I think we addressed this a little bit in the presentation, but skin of color, and is there a different recovery period for skin of color?
So this is, again, one of the most exciting things that we can offer. So in skin of color, lasers have always been something that you had to be extremely careful about. Some of the worst complications that I've ever seen, not for me personally, but out there, are when the wrong laser was used on somebody who had melanin in their skin. So the good news is that this laser can be used on any skin type down to the darkest skin. Obviously, there are things that we do to tweak the settings to make sure they're safe, but we can treat things, even like deep things like acne scarring, on African-American skin of any shade. And so I'm very, very, very happy that we can now offer this to everybody.
And then I think the last biggest question that I've seen a couple of times here is, can you just go into more detail about the recovery time for 3D Miracle versus UltraClear and what, they can expect day to day post care?
So the 3D Miracle, I say their phase 1 is the first 3 to 6 hours, and you're just gonna feel hot like a bad sunburn. And that just ice packs and keeping your skin cool down. After that heat dissipates, there's no more discomfort, there's no pain. You might be a little swollen, a little bit pink for the first couple of days, and a little tender. You don't have to hide out, although, that's going to be up to you as to when you feel comfortable returning to social activities. I would say by day 3, what you would see if you looked really closely at your skin is a small grid-like pattern on your skin, and that corresponds to where the microbeams have treated the skin. And then that grid-like pattern will turn into tiny, tiny little crusts so that when you touch your skin, it feels like sandpapery. So it just feels a little rough. And that will gradually just wash off during the week. So at the point where it's just rough, you can put sunscreen on, you can put makeup on. It's not going to be totally smooth. You're not going to look your best. So, during that week, you definitely want to plan so that you're not doing any, major events, major social activities that you want to look your best. By about 1 week, all of that will be gone and you can pretty much return to all normal activities.
Okay. And is there a limit to the time of year you can do this treatment?
And I do get that question often, and my answer is this is done year-round in Southern California and in Florida. So it just all depends on how you treat your skin. I mean, if you're in a sunny climate, you're going to make sure that you stay out of the sun, wear a hat with a brim, wear a good sunscreen, and you can do this year-round as long as you're careful.
I think that's everything we have for tonight.
Yeah,
so thank you all so much.
Thank you guys for coming. We're obviously, you can hear how excited we are about all this, and we're very happy to answer any questions that you have. I think this is a great tool. We've been doing tons of them since we started, so have lots of experience and happy to share it with you.
Yeah, thank you all so much. Have a great night.